Guys, we are going to go ahead and do some injuries today. And basically, I'm just going to talk for about 20 minutes because that's about the amount of work that I'm supposed to give you. And we'll see how far we get. And then tomorrow, you need to be prepared for a little quiz over like what we've done today and what you were supposed to do yesterday. Um, and that quiz will I'll give you a couple of attempts at it. So if you've done what you're supposed to do, then you should be okay. All right, so an acromioclavicular joint sprain. So remember, this is what the joint is between the acromion process and the clavicle. So like right here is where it is. And usually this happens because someone gets hit or they fall on an outstretched arm. So you're going to see a theme here about that, like falling on an outstretched arm. So the signs, they will have point tenderness and pain with movement, but with a grade 1, there's not going to be any disruption of that joint. If they partially tear it, then that lateral end of that clavicle might be a little bit moved, and they might have decreased range of motion. And then if they completely rupture those ligaments, the acromioclavicular and the coracoclavicular, which is like the coracoid process is just down a little bit from it, then there would be gross deformity. So what do you do for it? Well, it's very simple, actually. You just need to ice it, stabilize it, and refer to a physician. So you don't need to try to do anything else with that injury. So feel free to pause, type, do whatever you need to do at this point. But I'm going to go ahead and go on to the next slide, which is special tests. So if you scroll down to the bottom of your chart, there is a place for special tests, but I will give you I'll give it all to you at the end, so you can just fill it in at that point. Oh, I went away. Where'd I go? There I am. Okay, I'm going to go ahead and hide myself so you guys can see the whole screens, but you can still hear me talking. So there's 4 tests you would do. So you can see in this one, the AC stability test. So he's just going to apply pressure from the front, from the back, and from both sides. And then the O'Brien's test, we will watch right here.
Perform O'Brien's test, point the thumb down and flex the shoulder to 90 degrees. Adduct the arm across midline. Provide resistance against further shoulder flexion and evaluate for pain. Repeat with the thumb pointing up and again evaluate for pain. If pain was present with the thumb down but relieved with the thumb up, it is considered a positive test, suspicious for labral tear.
Okay, and they said suspicious for labral tear, but also for AC joint instability. Okay, so that's O'Brien's test. Like I said, I'll give you all of that typed up at the end. Okay, shoulder impingement syndrome. So impingement by nature is just like there's not enough space for something. So this is the compression of the supraspinatus tendon. Supraspinatus, remember we talked about this. This is the muscle that's above the spine on the scapula. It also can get into the subacromial space, so use your knowledge on that one. Sub meaning below, acromial meaning acromion. So there's a bursa right below that. And then which is right here. And then there's the long head of the biceps tendon. Also, so the biceps tendon right here runs through there. So there's not enough room under there. And we see this a lot in overhead repetitive activities. So tennis, volleyball, baseball, softball, swimming. Those are really common. So it's going to be a diffuse pain. They're not going to be able to say it's in one spot. And there'll be pain upon palpation. They'll have decreased strength of their external rotators, and then positive impingement and empty can test, which we'll look at in a second. So one of the main things you need to do with these is restore normal biomechanics in order to maintain that space between there. So if there's a way that they're moving their arm that's not working, then you need to work with them in therapy on getting it moving the right way. Also strengthening of the rotator cuff and the scapula stabilizing muscles. So the rotator cuff is supraspinatus, infraspinatus, subscapularis, and teres minor. And then the stretching, and then you could modify some activity as well. So we do 2 tests for shoulder impingement. So we do what's called the Neers test, and we do the Hawkins test. Whoops, there's the APC workout for anyone that wants it. So Neers test